Hello friends, welcome to Creative Medicine. In this lecture, we will learn about post-traumatic stress disorder. False statements are: symptoms develop immediately after event. No. Symptoms include they develop after 6 months of event. Okay. Symptoms include insomnia and poor concentration. It is the response to an exceptionally stressful and catastrophic stimuli. True. Anxiolytics are given only if anxiety develops. True. So this is the false statement. Next. If symptom develops immediately after stressful event, it is called as acute stress disorder, not the post-traumatic stress disorder. Number 1. Number 2, the patient develops insomnia and poor concentration with flashback of episodes and all other symptoms, and this is mainly to stressful or catastrophic stimuli like earthquakes, floods, tsunamis, etc. If the patient develops anxiety, anxiolytics can be given, like benzodiazepines can be given, or selective serotonin reuptake inhibitors can be given in post-traumatic stress disorder. Thank you, and thank you for watching.